can't change you to the absolute normal. We can give a near normal look. All are more or less amenable to surgery, and obviously non-surgical methods are also there. So almost all the scars are ready. As such, there are no age or health restrictions. They should allow the doctor to examine the part where the scar is, even if it is in the private parts. They shouldn't hesitate.
Ma'am, who is an ideal candidate for scar correction surgery?
The ideal candidate is a candidate who is dedicated to follow the advice first of all, and obviously practical minded, because sometimes patients come up with the ideas that plastic surgery means it is a totally scarless procedure. It is nothing scarless. We can't change you to the absolute normal. We can give a near normal look. So you should have that kind of practical mindset that you are coming here to improve your looks, not to get something very imaginative things like you see in the TVs or not like that. So you have to be practical. So ideal candidate should have a good mindset that okay, I have a scar which is creating business problems and I will be better after the surgery, but not absolutely normal that was before. Then another factor is that certain scars which are very old are not amenable to surgery, or even if surgery is done, gives less than satisfactory results. So newer scars are better managed than the older scars. And the third point is that the patient should be very dedicated to follow the instructions, like certain pre-op precautions are necessary, some post-op care. So they should abide by all these principles that are instructed by the doctor. That is very essential.
Ma'am, what type of scars can be corrected under scar correction management?
All the types of scars, be it a scar due to a burn injury or due to some accidents or post-operative scars, or maybe some kind of congenital scars like vascular lesion scars, acne scars due to some infections, all are more or less amenable to surgery. And obviously non-surgical methods are also there. So almost all the scars are dealt with.
Ma'am, what are the different techniques for scar correction?
Techniques can be broadly divided into either the surgical techniques or the non-surgical techniques, the invasive and the non-invasive. Now the surgical technique, there are a lot of techniques like we do Z-plasty, W-plasty, flaps, grafts, skin expansions, tissue expansion procedures, fat grafting, micrografting. So serial excision of scars, a lot of procedures are there. And among the non-surgical part, the lesser invasive, there are injections of steroid or immunomodulatory agents into the scar. Then there is chemical peeling, then there are lasers, then there are fillers. So there are also a lot of options.
Ma'am, how do you determine which technique is best for a particular scar?
Determination depends on the nature of the scar, the extent of the scar, and what is the patient's choice. Patient's choice has to be given priority, definitely. So certain scars are, I have to say, a very limited sort of scars are there which can be treated only by the non-surgical part, because most of the scars are first treated by a surgical procedure, and then as an adjunct we can add the non-surgical part. And among the surgical options, obviously there are a lot of options. So like if it is a very big scar, so you can't do it in one go. You need multiple sessions, you need serial excisions. If it is a small scar but it is over a joint and somewhere, when after the excision of the scar there will be a big defect. So you need to do a grafting or a flap, that is a chunk of tissue has to be placed there. If it is only for a cosmetic reason, then we can do it in a one go, maybe in a one go. Then after doing that, there are certain procedures like fat grafting, which gives a better elevated look, plumpy look to this part because it has depressed. So it all depends on patient's choice, because some patients prefer one technique over the other. So that is obviously a part, because I can't just say this is okay and this you have to go by this. They also have to say something. So it is all two-way communication once we decide.
Ma'am, are there any specific pre-operative instructions for the patient?
Pre-op instructions are there. We do a routine investigation for all patients before we proceed for any kind of procedure. So patient needs to do a few basic investigations. Then they need to have a pre-anesthetic checkup. Once they are declared fit, then we can discuss for a convenient date and perform the OT.
How do you think a patient should prepare for the scar correction management?
Preparation is, as I've told before, a mindset is a very important thing, because you're going for a scar correction which is mostly surgical. Even if it is a non-surgical, also you have to come to a clinic or somewhere where you have to go through a procedure. So don't be apprehensive, don't be nervous, nothing to be scared of. So make your mindset that, okay, I'm fine with it and I'll be better after that. Second thing is that you need to clean that area. It should be a clean, hygienic area. Don't talk with a dirty area where the scar is. And if it is a hair bearing area, shaving is important. You need to shave that area. So these are the points should be done.
Ma'am, are there any age or health restrictions for scar correction?
No, as such, there are no age or health restrictions. But obviously, the extremes of age, like very small babies or very elderly, they can be put forward for the observation or massage creams and all, rather than going for an invasive procedure. Unless and until it's very essential, like I have told before, certain scars are over the joints causing restriction of function, movement. That is obviously a need for the surgery. Otherwise, there is no as such bar for age.
Ma'am, what can the patients expect during initial consultation of scar management?
Initial consultation is actually a physical examination and recording session followed by a counseling session. So in this session, we tell the patients like what kind of scar you have, what all procedures can I provide, how much correction can you have. All these things, a general discussion, that is a counseling session basically. Second point is that it is a physical examination session. The patient should be very frank with the doctor. They should allow the doctor to examine the part where the scar is, even if it is in the private parts. They should not hesitate, and they should not hide any history. They should give everything, whatever they have in their past history, whatever drugs they are taking, how it has happened. They should tell everything. And the third point is, as I said, recording. In plastic surgery, we have to keep a photographic evidence of the scar process, whatever we are doing. So it is not for any disclosing of identity. We never disclose the identity of the patient. It's only for future reference. So patients should allow us to do that. They should give that consent. So this is the basic thing which we do in the first session.
Madam, what do you think should a patient ask to the surgeon during initial consultation of scar correction?
Yeah, that's a very good point. In the first counseling session, the patient should ask what kind of treatment is to be given to the patient, first thing. Whether the scar is correctable, if it is correctable, to what extent correction can be achieved, how it can be achieved, what all surgical procedures are there, is there any non-surgical procedures, overall things, how long will it take, how long the patient has to stay, how long will it take to heal, and one more factor is the price factor, how much will it cost. So they can ask all the queries they have in their mind.